Good afternoon, everybody. This is Dr. Duncan McCollum coming to you live from KSCO. I have a guest speaker with me today, a good friend of mine. He's been on here three times at least before, Dr. Matt Diderot. And it's good to see you, my friend. What's new in the world of stem cell and our soft wave therapy machine?
Yeah, I mean, some exciting stuff happening out there. So excited to bring you up to date. First off, Dr. McCollum, thank you for over the last 3.5 years to give us a platform we can share this information with not just our communities, but on a national level. So you've been just wonderful at helping us get this message out. I remember 3.5 years ago, first time it came on, I said, Softwave has an identity crisis. No one knows who we are.
Yeah.
And you, my friend, have helped us really get a footprint out there and have a nice presence in our community. So thank you for that.
Yeah, thank you. As you know, the reason I even got this was because an injury that I had, which is usually from pain to purpose. I couldn't lift my arm, and being a real busy chiropractor, it's a little bit of a problem when you can't use your body. So, I'll just tell the story quickly because a lot of people haven't heard it. But, back in 2019, just accumulated injuries over the years. The first time I ever hurt my shoulder was in fourth grade, throwing a baseball, trying to throw it as far as I could, and caused that first injury. And I've injured it several times since then. Scar tissue upon scar tissue upon scar tissue. Finally, one day at work, it got so bad I couldn't even lift it off of my side. And I went so many different avenues to try to get this handled. And, I was kind of thinking, gosh, do I have to do something radical here or not? And then a mutual friend of our son, Dr. Dan Pompa's son, Daniel, jumped off a 60-foot cliff and missed the water, shattering both heels and landing on his tailbone and shattering three vertebrae in his back, three thoracic vertebrae. And it was quite devastating. He was like 21 years old, maybe. And I
20, yep.
remember, huh? Yeah, 20.
About 20, yep.
I remember, Dan Pompa and our group of platinum doctors getting together and trying to figure out what to do, all kinds of different treatment protocols. And then all of a sudden you entered the picture with your stem cell machine, soft wave therapy, tissue regenerative therapy machine. And unbelievably, within 4 weeks, the kid was walking. They didn't have to put a steel cage around his back like they wanted to, which is devastating, period. But for a chiropractor to have to do that to their son would be unthinkable. And then 2 weeks later from that, he was in Europe walking around. So
Yeah, we went backpacking in Greece.
yeah,
You know,
unbelievable. So tell us a little
so
bit about this machine, how you came across it, and what we're seeing today with all of the
sure.
advancement. I
I
mean,
mean,
you've got hundreds of these around the country now.
almost 1,000, 700 at this point. You were the number one. You were first in California, followed by Dr. Scott Kramer.
Yeah.
And yeah, I remember training you. I think it was September 7th, 2019, and in your beautiful office in Santa Cruz, which I just love. And yeah, I mean, it was like you guys were the original 12 pioneers from Dr. Pompa's group of Live It to Lead It docs and health centers of the future. And it was great because we were able to track that data on those original 12 doctors, you being one of them. And what we started realizing was that patients that were coming in with arthritis and pain, basically wherever we placed this device on them, the pain was going away. Now, this is genuine lithotripsy. And I've probably said this for 3.5 years, but I'm going to kind of repeat it and hammer it home. Lithotripsy has been around for 40 years. This is, they use electrohydraulically produced supersonic sound waves that are traveling at 3,355 miles an hour, and they can penetrate the depth of a soup can into your body. And it's working on a cellular level to help downregulate inflammation and pain, as well as upregulate circulation and range of motion. So it's just like this. Who'd ever thought that taking basically two natural occurring phenomenons, the lightning bolt and thunder, placing it into a handheld applicator, and then being able to point it at the human body and create a positive biological effect.
You know, the amount of changes that we see and the miracles that we see almost on a daily basis, and probably on a daily basis in our office and across the planet, that people are doing this thing is so phenomenal. And the fact that it's just sound is, I have to remember, it's just sound. And of course, it recruits your own stem cells into the area, which
Yeah,
is key.
we now have 24 papers that are showing activation of stem cells, which are the repairmen of the body, within 45 minutes of treatment. So they're migrating. These helper cells and repair cells are coming to the area of treatment. And this device, we've said it before, I'll say it again. You have to feel it to heal it. That one of your patients actually came up with that, and they coined that phrase. And these supersonic sound waves are, able to compress the cell membrane and then expand it by 10%, and that creates a shearing force that literally knocks off oxidative agents off that cell membrane and improves the permeability, and you get nutrients in and waste products out. But the other thing that's pretty amazing is it's activating the mitochondrial. Now these are the powerhouse of your cells, and they're basically in every cell in your body except the red blood cells. If
Right.
you were to take out your mitochondrial, they make up 15% of the weight of your body.
Hmm.
But they do so much more than just the powerhouse. They're actually part of your immune system. So this is working at an innate level, activating your immune system and calling out those first responders, those helper and repair cells to come to that area to literally start that whole regenerative healing cascade.
Yeah, the more I use this, I just had a meeting Friday with two of the people that are doing the treatment in my office. One is Angus, my
Mm-hmm.
son, who probably has done more of these treatments than almost anybody on the planet. I mean, he's been doing it since the day we got the machine and repaired his fractured
I
hip with
trained
it.
him.
You did
I
train
got
him.
to train him.
Yeah, and he loves it, and so he does that. And then I have a nurse, Alyssa, who's doing it, who's just blown away by the technology. But one thing that I realize as we're using this machine is it's really two purposes clinically. The first one is to help reduce the pain and create more livability for the patient. That's what is the remarkability of this machine, is when people come get up and start walking on that knee or that low back, or the foot, move the shoulder around, they go, wow, it's better. My first treatment, my shoulder, I had 40% range of motion where I had zero going in. And my second treatment, I had 80%. So I bought it. I bought one. I just went out and,
Yeah.
pulled the trigger
I
and
remember
bought
you
one.
called me on the way home from your second treatment and were like, I'm
Yeah.
ready.
Yeah.
You
And
knew. And
we've never looked back. But the point I was going to make is, when we treat a joint, a lot of times, like, we'll work around where the machine tells us to go because you feel it when it hits scar tissue. But when we look at the actual articular surface of a joint, like a knee, the cartilage along the knee, or in the joint, I make sure that my staff hits that area for a good portion of the time, because we know that the sound wave is going to break down the old damaged cells so that the stem cells have a place to come and land and evolve into more of that tissue. The stem cell can become anything. It's like it's a
that's right.
chameleon.
These are mesenchymal stem cells. They are embryonic in nature. So wherever they land, they actually become that tissue or organ or whatever. The thing you got to remember, that really puts this technology into a different stratosphere, is the fact that there is a diagnostic component as well as a healing mode. So when
Yeah.
I say diagnostic component, I mean, we know within 5 minutes if you're a candidate for this therapy. Ask me why.
Yeah.
Ask me why, Doc.
Why is that?
Because when you run it over normal tissue, there's no pain or discomfort. As soon as
Absolutely.
you get to areas of where there's inflammation, arthritis, poor circulation, or damaged tissue like torn ligaments, there's a biofeedback component where the patient will be like right there.
Yep.
And you can point where the true source of pain is coming from. Now we're in 15 professional sporting teams. When I
Wow.
first talked to you, we were in like 3 or 4.
Yeah.
So let me go through who's utilizing this technology at a professional level.
Yeah.
In baseball, it's the Atlanta Braves. They just got the new supercharged system. And I have a great story about Ronald Acuna, who's one of their franchise players. The Chicago Cubs have been using it for over 4 years. The Cleveland Guardians, so that's the Major League Baseball. We have 3 NFL teams, the Miami Dolphins, Dallas Cowboys, and Pittsburgh Steelers. And then we have 5 NBA teams, the New York Knicks, the New York Nets, the Memphis Grizzlies, the Orlando Magic, and the LA Lakers. Okay.
Wow.
So we're also now in the Premier Soccer League. Tottenham has a device, as well as Newcastle is demoing one right now. So it's exciting. We've been with the UFC for almost a year now. I'll be heading out there next week, just checking on everything. But I'm super excited the way they're finding it organically. You know, we're not marketing to professional athletes. They're finding it because they're hearing it through their channels, right? And the
Yeah.
biohackers. That's where you're huge. And I mean, you are really one of the key opinion leaders in the biohacking community. And that's like the Dave Asprey's and the Bullet Coffee and these doctors who are looking at longevity. You
Yeah.
know, we've also
Absolutely.
placed this in a dozen anti-aging and longevity clinics.
Yeah. It's as you know, when we started getting this machine back in 2019, after the whole thing happened with Dr. Pompa's son, I was the first one to go, let me have it. And then now I think there's 20 of them in our group, and people are having so much fun making it work. So this woman, when she first called the office, she lives out of town, and she talked to Natalie, who's my office manager. And Natalie came to me and said, this lady, she really said that she's at end of life. I was pretty scared. I don't know what to do. So I said, well, I better call her before we make her drive up here. And she called and told me that she had been diagnosed. Literally, she has so much steel in her back. Um, it's like she's got 8-inch screws going from her sacrum into her pelvis on both sides, and metal from L2 down to her sacrum. So pretty immobile, and a condition that's known as arachnoiditis. And I called you and I said, hey, Matt, what can I do? I hadn't heard the name before, but as it turns out, I've treated a lot of it before, and without knowing it. Arachnoid means spider or spider's web. And by all of the surgery she's had, the lower lumbar spine, the low back, that web had kind of basically seized up or solidified and entrapped the nerves. So there was nothing that she could do medication-wise to kill it or kill the pain. And the doctors even said some of her nerves were dead. But by doing this sound wave through this part of the body, the supersonic sound goes in there and it breaks down the scar tissue around that arachnoid netting that was entrapping her nerves. And she got out the first visit. She was like 40% less pain. Her son was there too. And he's, in his 20s, and he's going, Mom, you don't even realize you're standing up straight, and she was smiling. And so it's pretty remarkable. And that's a pretty extreme case. It's kind of funny. Sometimes the more extreme cases get the better, quicker results.
Yeah, I noticed that. I mean, this is not some fly-by-night type of organization, Softwave. We've been around for 16 years. This is a third generation lithotripsy, so you understand. We have actually spent over $25 million in research and development. We spent over $10 million to get Class 2 clearance through the FDA. And we are now, it is covered for wounds, diabetic ulcers, burns, and we also have a Class 2 clearance for activation of connective tissue. And that's
Hmm.
important because that's the fabric of life. That is the building matrix that makes up the bone, the nerves, the organs, the adipose tissue, the skin, so it helps. I mean, the company's name is Softwave Tissue Regeneration Technologies. And someone we have to give a shout out in the Bay Area is out of University of California, San Francisco, Dr. Tom Liu, who is a world-renowned urologist and researcher, and his team is pumping out 10 to 15 papers per year on how our device, SoftWave, is literally creating positive biological effects in the body. Especially, he's the one that's really been pioneering the way on how we're activating stem cells. So it's pretty cool when you have like your local university is really is showing us in the world how versatile this technology can be.
Yeah, it's amazing. Now, you were telling me that a new football team was using this thing too?
Well, we just for the last year and a half, the Miami Dolphins and the Dallas Cowboys. I just came back from the Dallas Cowboys chiropractor,
Uh-huh.
Fred Casper. He got one, and it was just amazing because he's been with them for I think almost 20 years. And Jim Maurer, who is the head trainer for probably 35 years, um, he was standing outside. It was before a practice, and there were literally 15 Cowboy players waiting in line to get into this little room. And Fred
Wow.
Casper came up and said, uh, "Jim, what's going on over here? What's they're giving away free cake or something?" He goes, "No, it's the Softwave." And he goes, "What's that?" And Jim tells him what it does and how it has regenerative capabilities. And Jim said, "We should check your wrist, Dr. Fred, because you've had that." He always has to tape his wrists up when he's working on these big players, and so all the players get treated. They go out for practice. Jim Maurer works on Dr. Casper, his wrist, one treatment. Like you had two.
Yeah.
Like you, he gets off the table. He's just like, OMG, this is
Yeah.
I can't believe it, right? It's near immediate relief. But one visit doesn't fix everything, but it starts
No.
the healing process.
Yeah.
So Fred literally says, I got to have one of these. And Jim connects me. And literally from that first session, the team chiropractor actually for the Dallas Cowboys ends up putting in his own clinic. And I just got back from there 2 weeks ago training him. And it was awesome. Like we're working on retired players, current players, and they notice it, right? These high level athletes that every day that they're not on the field, it's costing their team money and wins. And so the quicker you can get back on there, the better. Dr. James Bradley, who's been the team physician for the Pittsburgh Steelers for over 31 years. They've had it for about 2.5 years now. He calls this a secret weapon to
Hmm.
getting players back on the field. He says nothing helps them. And again, this
Yeah.
is professional athletes that are worth millions of dollars, but this technology is now available right in your community for Santa Cruz. Think
Yeah.
about that.
Yeah.
This is
Pretty cool.
true cellular regenerative medicine that for the working class person and weekend warrior
Yeah.
in our community here.
I'll talk about that in a second, but they started off working on racehorses, right?
I mean, the technology has been used for 30 years on thoroughbred racehorses. That's right. And in January of 2018, the racing officials made it
Huh.
illegal for these racehorses to have this treatment done 3 days prior to a race
Wow.
because they considered it a performance enhancing device.
Hmm.
So, I mean, and they police it pretty well. There's one horse trainer in Ontario, Canada, who lost his license for 6 months because he didn't want to have his athletes, his horses, not able to utilize it.
Wow. And performance enhancer, that's pretty cool. I think about patients and I see people come in and on my entrance questionnaire, I ask, is their condition affecting their mood, their energy, their hobbies, their family, their ability to work. And so often people will say yes or no or maybe. And what I find is, and you've probably seen this too, over the years, people, that exciting glimmer in their eye to go out and conquer the world gets dimmer and dimmer and dimmer as their body's ability to perform lessens and lessens and lessens. So because there are no really great answers like this, to date, except for now that we have this, it's been medicating or different self-medicating, just deciding that you're not going to go out and garden anymore, or, you don't want to play basketball because, yeah, I just used to do it. I don't want. And they're changing their quality of life because they don't have an answer that will turn their body around. And we do the $49 special just to see if it helps. So, and I
Yeah,
was
I mean,
talking.
well, it's really a diagnostic way of checking to see if this patient qualifies, and that's what's
Yeah,
beautiful. It's not going to cost you an arm or a leg to find out if this works. And
yeah,
by the end of that first session, within 5 minutes of your appointment, we know. And that's the thing I love about it is, when you started out, you were the first one in California. We had maybe, I think, 100 in the whole North America. We have it now at Mayo Clinic, Cleveland Clinic, Harvard. We're at Baylor University, University of California, San Diego, at some of the top research centers. We now have it in close to 700 clinics across the country. We're
that's
in
amazing.
13 trauma centers in Europe. So if you're run over or hit by a bus, the trauma surgeons will put you back together, but they'll use this right in the OR before they send you home.
Yeah.
And now I'm so happy to report that we're in the first trauma center on the West Coast at UCLA Medical.
Wow.
So that's huge. And, big shout out to John Warlick, our CEO and founder, who, worked hand in hand with these surgeons and the administrators to get this technology out there. And basically, he flew out to do a demo, and he asked the trauma surgeons and the directors of the UCLA to just line up 7 or 8 of their cases that just weren't responding as well as they thought. And John Orlick went out there with the surgeons, and he treated them, and it takes 10 to 15 minutes. And patient after patient, they got out off the table and they're like, "When's my next visit?" They felt
Yeah.
great.
Yep.
John had to leave the demo device there
Hmm.
because they wanted to keep that healing cycle going. And the great thing is you only need a handful of sessions to
Yeah.
get the optimal healing factors
Yeah. You know what?
launched.
Our friend Dr. Curtis Martin, who's up in the Bay Area, we talk quite a bit because he's got a couple machines himself, and we share stories. But basically, this machine, it works every time. Now, it may not get your pain to go away right away every time, but we know on a cellular level, it is doing a physiological transformation of the tissue there. It's either blowing out some of the swelling, or it's getting some of those toxic chemicals that are causing pain out of the area. It is going to, over time, cause the regeneration or neogenesis of new capillaries in the area, as well as bring in the stem cells to rebuild what it deems necessary. So, it's such
Yeah,
a.
that
Go ahead.
the thing you've got to remember is this is this is not damaging tissue. There's
Yeah,
other doctors out there who have cheaper devices. They're radial in nature. They
yeah,
pound on tissue. They're ballistic. They cause trauma. This is not that. This is utilizing what's called mechanotransduction. That's a really important concept.
hmm,
And we have a high pressure, low pressure, and there's really a primary supersonic sound wave and a secondary supersonic sound wave. Because you live by the beach, your listeners will understand. It's like when you're standing in the ocean and the wave hits you the first time. That's a positive force. But as the water sucks back into the ocean, that's almost as strong. It can knock you off your feet. That's exactly what's happening on a cellular level as we're compressing the cell and then expanding it. And that
wow, that's
that
cool.
really that that shearing force helps knock off oxidative agents, but also helps shed exosomes, messenger RNA, and extracellular vesicles. Those are the stem cell attractants. Those are the ones that are like, hey, we just got hit by something. Come check it out. So your innate immune system calls into action the first responders, right? So,
Yeah.
like your firemen and your ambulances. So those are your helper cells that are coming to that area. And they start laying down the tracks of the healing. And
Yeah.
so again, your innate immune system, that is so important. That's your defense mechanism. And what we're finding is those first responders, the main one that we're working with is called toll-like receptor 3 and 4. And these are so important in modulating inflammation. Inflammation, as you know, Dr. Duncan, is really the true culprit and silent killer in so many disease processes and also in aging. And so the holy grail for the last 50 years is what pharmaceutical company can come up with a drug to stop or slow down inflammation. They're trying to find a drug, a pill, or a shot.
Yeah.
And the thing is, it's like, what if it's not going to come from it? What if it's coming from harnessing the power of basically a lightning bolt and thunder,
Hmm.
and creating this handheld applicator that we can point at areas of pain and discomfort and really flush out that inflammation or downregulate it, turn off that inflammatory process, which gives the body time to repair, recover, and regenerate.
Yeah.
We are on a mission to end pain and suffering for millions of people without the use of strong narcotics, drugs, injections like cortisone, and even joint replacements or surgery. You got
Yeah.
to think about cortisone. Cortisone has, I mean, when we were growing up, they used to say you could only get 3 in your lifetime. You remember
Right.
that?
Yeah.
Well, there are 33 negative side effects to a cortisone injection. Do you know that a surgeon will not work on you or operate for 3 months if you've had a cortisone injection?
I did not know that.
Yeah, because it weakens your immune system and your ability to heal after that
Wow.
surgery.
Wow.
The other thing is, oh, I got a shoulder issue, I get an injection. Do you know that it can accelerate the arthritic process of that joint? The
Yeah.
same thing you're putting it in to fix, it's actually creating a long-term problem. And
Yeah.
then the third thing is it can actually create osteopenia or
Hmm.
osteoporosis in the area
Right.
it's been injected. Those are
And
the
that's the
three top
thing.
ones.
Yeah, that's what happened to Joe Namath, right? I mean, they had put back in the day, they kept that guy going and they put cortisone in his knees and pretty soon he had nothing left because it does break down. And this is what I tell the patients. It breaks down the connective tissue over a period. It might give you some short-term relief from inflammation, but it's breaking down the connective tissue, the joint capsule itself, and leaching calcium out of your bones. We obviously don't even do this treatment on somebody if they've had a cortisone injection they have to wait at least a month because we know that
21
it's
days.
21
Yeah,
days.
it's catabolic in nature. It means it's breaking things down.
Yeah,
And some people can take anabolic steroids and it makes their muscles bigger.
yeah,
Unfortunately, these type of cortisone injections are the opposite. They're catabolic and they break tissue down. So yeah, we wait 21 days at least. And the thing you've got to remember is that there's only 1,300 of these worldwide.
wow.
700 are in the United States, 400 are sprinkling the rest of the planet. But when I go to these research, and I want you to come, we're going to be in Amsterdam in 2024
That sounds fun.
for our International Research Symposium. So I welcome you to come, and I'd love to invite you. And we have 200 doctors that come in from all over the world, and they're there presenting their research papers. And as a chiropractor for 28 years, I've never seen trauma surgeons, urologists, orthopedists, neurologists, chiropractors, physiotherapists, acupuncturists, all coming together, all these different specialties coming together to share the research and how this is actually transforming healthcare.
Yeah.
And
It's that's
and
crazy.
again, it's the great equalizer. It's all these different
Hmm.
subspecialties that are like, look how we're using it for this. Look how we're using it to help regenerate nerves. Look how we're doing it for even erectile dysfunction.
Hmm.
Even women are using it for different conditions. So that's the thing I love. It's this movement. And medicine in this country, unfortunately, has become an industry.
Yeah.
And they're the orthopedics and surgeons can make more money by cutting
Yeah.
than you healing.
You
And
know, we spent $4.3 trillion, 4.3 trillion on healthcare in 2021 in the United States, and we're still rated 47th in the world for health
yeah,
and take
yeah,
more drugs
but
than anybody.
you look at this, it's like all these doctors coming together, all these different
Yeah.
subspecialists using it for all these different conditions, basically anything that ends with an itis, because that means inflammation, arthritis.
Yeah.
Not that we're reversing arthritis, but what we're doing is we're blowing out that inflammation that is really the main culprit of where the pain is coming from.
Yeah. So
And
the
so,
real healing can occur after that. You know, I mean, as a chiropractor, you and I have been chiropractors for years, and in 30 plus years, I never had anything other than my hands to adjust people and the thing called an activator. Never anything. And because I
mhm.
never liked putting blue ice on somebody and hitting them with this kind of vibrator or that, to me, it was bypassing the body's innate ability to heal itself. It might have given them some temporary relief, but I'd send them somewhere else for that because it wasn't what I was trained to do. But when I found this machine and I realized that chiropractic works on the macro environment, really. We're looking at the spine, the nerves from the brain down. There's 31 spinal nerves that go to 75 trillion cells. Those have to work well. But at a cellular level, the world has gone so crazy that the body has such a hard time um, pinpointing and prioritizing these kind of traumas and inflations in the body. And this is what I'll say about this is like when I hurt my shoulder, I knew that, right here where the biceps tendon attaches to my upper arm, I'd had that hurt and ache for years. And it's where the muscle attaches, excuse me, the biceps, the deltoid muscle. But every time I injured it, there was a trauma and it almost healed. And then the body had to go handle the next problem and the next problem. So I have layer upon layer upon layer of 80, 75%, 80% healed injury. So it never got a chance to heal. Nerves grow into that scar tissue, and that's why it's so painful. So when we put the TRT machine on there, it calls the body and says, "Hey, finish the job you started here. Go in here. Let's blow out this scar tissue. Let's free up the nerves. Let's get the inflammation out of there. Let's bring in new stem cells so that the body can heal." And it brings its attention there. So for a chiropractor, this stem cell machine is, it's the second half of what we do. So between the two of them, we get amazing results. Sometimes people come in with knee pain, and I'll take a picture of their low back, or if it's their shoulder, their neck, and go, "Well, you don't have any disc left in your back. How is that nerve even going to get to your knee?" So sure, the stem cell machine will do everything it can there, but we've got to make sure that the brain can communicate to the rest of the body.
That's right. The body is a self-healing, self-maintaining, self-regulating healing machine.
Yeah,
And what we're doing is just helping unlock that true healing powers or
yeah,
accelerate it. Cortisone is looked at in the rest of the world as barbaric.
yeah.
It's a last resort. Unfortunately, here in the United States, it's the standard of care.
I know.
Drugs, strong narcotics, pills. I mean, we are getting coming out of the other end of this pandemic, right? This this
Hmm.
this COVID thing, but we can't forget that we're still in an epidemic, and the
Yeah,
fact that we still are having close to 1,000 people die per week for prescription drugs overdose, fentanyl, opioids. It's like those should be the last resort. And unfortunately, they've become a way to treat both acute and chronic issues. And you
yeah,
take small, short-term issues and they become long-term problems. And I saw an interesting fact. I'll be quick, but the American male's life expectancy has been rising since 1914, all the way to 2016. And for the first time in over 100 years, our life expectancy has gone down.
Hmm.
And it's gone down for the last 4 years, 5 years. And it's a direct result of this opioid epidemic, fentanyl epidemic that is causing it to lower our life expectancy. And
Yeah.
I just want to give patients options, right? If
Yep.
someone's out there listening right now, Dr. McCollum, they're suffering, they can't go up the steps, they've given up golf or pickleball because they're in so much pain. Those are the people that I want to come in and find out. I kid my staff. We're like the Statue of Liberty. Like, send us your tired patients, the ones that aren't healing,
Yeah.
and
Wow.
come on in and let's find out if you qualify for really this futuristic technology.
Yeah.
And all it takes is 10 minutes. Who doesn't
Yep.
have 10 minutes?
Absolutely. And oh, every day. It's
Yeah,
unbelievable.
I love it. I mean, it's, in close to 30 years in healthcare, and you got a couple of years on me, Doc. It's the last 6 years of working with Softwave and sharing this specialized knowledge with doctors like you around the world. It's been the most rewarding part of my career. Uh, I mean, listen, I'm a dyslexic kid from New York that had ADHD. I'm lucky I made it through high school, let alone go to college. And if I wasn't playing college lacrosse and got injured, I would have never found a chiropractor who helped me and then really pointed me in the right direction. But I laugh now because my life has been so blessed. I mean, I'm showing a picture right here of do you know who that is?
Nuh-uh.
Duncan, can you see that screen?
Yeah.
That's Larry David from Curb Your Enthusiasm.
Oh, really?
Yeah, and we were lucky enough to be able to work on him. Now, the story behind Larry is he had gone in for stem cell injections in his knee. Now, regenerative medicine may be the future of healthcare, but right now it's the future for millionaires, professional athletes, and A-list celebrities.
Yeah.
This is giving really true cellular regenerative healing options for everyone. And I like it because here's a picture of just as many of the different groups that we work with, both the NBA, NFL, NBA. We were featured on the show The Doctors back in November of 2019, where they nicknamed it the stem cell machine.
Yeah.
So we now have 700 of these. This is, the Pittsburgh Steelers. Kevin Durant, who used to play for the Golden State Warriors, when he tore his Achilles, he flew all the way to New York City to see Dr. Martin O'Malley, the foot and ankle specialist for the NBA. Dr. O'Malley has two of these devices.
Wow.
Laura Rossler, who was an Olympic hopeful, a wonderful young lady, we used it on her. Graham McDowell, who's now on the Live Tour. I mean, he's a PGA champion as well, an Olympic athlete. So, the thing that I love about Dr. O'Malley, he says, if you're practicing sports medicine in 2022 and beyond, then you need Softwave technology in your clinic
Yeah.
to really help get these people back in shape. And
I,
this
I
is,
agree.
this is the beautiful thing about this technology. It's non-invasive. It's same day procedure. There's little downtime. The FDA labels this as a non-significant risk factor because there's little to no side effects. I mean, what do you have to lose but the pain that's stopping you from doing everything you love?
I know. And people come in and they ask why no insurance covers it, and it's like, that's so new. The insurance companies won't cover this for a long time, more than likely, for several different reasons. But we do a $49 special so people can find out, because if it works and nothing else works, it's priceless. To get your
Yeah,
life back, to get your hobbies
there's
back, to
no
be able to
amount of
play with
money
your
they'll pay
kids.
you. There's
Huh?
no amount of money that they can pay you.
Yeah.
This is one of the screens I was just showing you about the lightning bolt, right?
I don't
That's the
see that.
natural.
I still just see the soft wave guy on it. I don't know. Yeah,
Okay.
but that's okay.
Escape.
Get it up there.
That's
Take
all
your
right.
time.
I'll get back to the Zoom. So, it's so much fun to watch patients who've been to doctor after doctor who haven't, you know, found relief through conservative measures.
Yeah,
So there's someone out there that's, been told, oh, I need to have a shoulder replacement, a knee replacement. This is a great second opinion. This is a wonderful way to come in and buy some time and really get some relief. That's
yeah,
what I want. So you can get a second or third opinion because 33%, and this is an amazing fact, 33% of joint replacements are failures because the pain is coming from the nerve or the neuritis, which
right.
is inflammation. And what did I tell you? This thing works at helping downregulate or reduce inflammation, which is really the main culprit where the pain is coming from.
So many times people come in, especially with knees, and they tell me that their knee is bone on bone. I pretend I don't even hear it because I will always take a standing knee x-ray. I'm literally 8 times out of 10, there's at least a quarter of an inch of meniscus
Sure.
left. And I don't understand why they're getting that diagnosis.
I'll
Um,
tell you why. It's somewhat of a scare tactic.
mhm,
Okay. And shame on some of our doctors out there because as a human being, we're three-dimensional. This is the Cartesian coordinates. We have an X, a Y, and a Z
yeah,
plane.
yeah,
Okay. So we're three-dimensional. You can't take a picture of a three-dimensional joint or person and put it on two-dimensional film. It
yeah,
just doesn't correlate. There's a thing called X-ray distortion, and you'll have distortion in the images and where they actually appear on. So it's like here's a perfect example. If you're standing in the middle of the train tracks, and if you look down into the horizon, you'd be sure that those two railroad tracks are coming together.
right.
But in fact, they don't. It's an optical illusion, and it's the same thing with bone on bone. So if somebody's out there like we used to kid my uncle Mario, he was bone on bone, right? Um, but that's just a way to dummy it down to tell this patient that they've got degeneration in the joint. If you
Yeah,
had true bone on bone knee, you're coming in a wheelchair. You're not walking it.
yeah.
Okay.
I mean, I see them. I have them come in with you know, crutches and canes or what have you with I mean, it looks bone on bone. Some of them you can tell that is really close. And even then, we do get relief. Not always as good as we'll get, with the ones that are
Early
less
stage
degenerated.
arthritis is,
So,
you're right.
don't wait, as I can tell you, don't wait till it gets so bad. But then again, the two success stories I sent you today, these people are coming back from
I love
pretty
it.
severe
Here, let me
surgery.
tell you something else that's pretty wild. The fact that you were first in California, the whole state, patients would drive hours to see you.
Yeah,
And then they would get the treatment and they'd get two or three treatments. They'd go back to their doctors in San Jose or Carmel or Chico or Redding. And they would say, they're like, look at my knee. It's all better. Look at my shoulder. Well, what'd you do? Oh, I went to see Dr. McCollum and he's got this device and it helped start the healing process. And then they would call Dr. Duncan and Dr. Duncan would hook them up with me. We've sold, I don't know, half a dozen devices out there in Northern California because of you.
wow,
And
that's amazing.
that's really, you're making an eternal impact
Yeah.
in the northern portion. So thank you for what you've done. You were an initial guy to invest in it. You were an earlier adopter in this technology, and thank you for believing in me
Yeah.
and really the technology that's behind Softwave.
Well, you know what? That's one reason I love having this radio show too, because I come out here and if a lot of times people get in their car and they listen to KSCO on their way to, the hardware store or what have you. And, if so many people come in from hearing the show. so many people come in and they say, you know, I've been listening to you and I finally decided to come in. So I just want to tell you guys, don't wait. You know, if you're in pain, come give it a try. $49. You know, it's either going to make a huge difference or maybe you won't feel anything right away, but it doesn't mean it isn't working. So, and
Hmm.
the funny thing, and we've only got a couple minutes left, Matt, but we don't even know how far up is up with this machine. I know that some of
Hmm.
your guys are working on some stuff that you may not even want to talk about right now on the air, you know, some of the stuff going on with the brain
Hmm.
and stuff. But, you know,
I'll tell you. I'll tell you quickly. First off, before we run out of time, I've been lucky enough to be at the KSCO studio twice in person, and
yeah,
it's one of the coolest buildings, retro.
yeah.
Thank you for having that radio station out there, to the owners that are just awesome and give us really a medium to speak to our patients and community. But here's the thing I love. Um, the cardiac, world-renowned cardiac surgeon Johannes Holfeld is now completed 67 bypass surgeries where he used our patented technology right on the heart during open heart surgery. I want
Wow.
you to think about this. It is not cleared or approved here in the States, but he's had 67. This spring, he will be published in Lancet, and we can't wait. But I'm going to give you a little sneak through in on what's going to happen here. And of those 67 patients, they had a 3-minute treatment performed, and then they were sewed back up, and they went home to heal. 1 year later, they had a 10% improvement in left ventricular ejection fraction that helps pump the blood and the oxygenated rich blood to every part of your body, from the tips of your toes to the tips of your fingers to the tips of your nose. So 10% improvement. And let me kind of put this into perspective. In the history of mankind, there's never, ever been anything that has helped cardiac regenerative therapy. This guy is the Elon Musk in cardiac surgery, because they're creating new words and phrases for what he's doing. And
Wow.
again, that's an invasive procedure, but we are working on a non-invasive, helping reduce pain, helping improve circulation. You talked about the neovascularization and stem cell activation. So, I mean, like, why isn't this everywhere?
Yeah, yeah.
We're having this conversation 3.5 years ago. Why isn't this everywhere? Well, the good news is that's our mission, and we're getting it there. We're in 13 trauma centers, UCLA, 15 professional sporting teams, and
Yeah.
I hope when you have me back next year, I can give you even more of a bountiful groups that are working with us.
Yeah, you know, I was thinking about this the other day. It's like, you know, everybody thought the world was flat, and nobody would go against the fact that the world was flat, you know, until Columbus sailed, right? And he disappeared over the horizon. This is like that kind
Uh,
of thing, man. The medicine is not flat. World health, your body's ability to heal is not flat. You know, this is like the
but
new world is
you're right.
being discovered.
Let me just say, I know we're almost done, but it is so true. Sometimes when I'm talking to doctors and I'm telling them the versatility of this, it's like I've just told them that the world is round, and they look at me and they go, "No, no, the world is a flat." You know, so
Exactly. And you don't want to go against it because you'll be chastised for going against the fact that the
well,
king says the world's flat.
thank you for being an early adopter, one of the first 12 in the United States, and the number one in California.
Thank you so much, man. And we talked about it being a tricore, right? On Star Trek. Bloop, bloop. That was the thing. We came up with that
That's
three and a
right.
half years ago. All right, man.
That
Well,
was one
thank
of
you.
your guys too.
Thanks
Peace and
so
love,
much, man.
brother.
I'll talk to you soon.
Always enjoy.
Okay, bye-bye.
That was a good one, right? It's good.
But when we talk about destruction,